What's the next skill? Mouth care. It's always fun to do this one after lunch. Okay. On this one, you do have to have a protector. It is listed in there because this is more like treat this more like a treatment than eating. You know, that's more of a social experience. This is another one of those where I find that kids don't know what to do with the toothbrush, and so it becomes a lethal weapon, and I'll show you how that can happen.
Sounds bad.
It is bad. About scared me to death one day. Can you crank me back there?
Sure can. Well, I said I can.
No, we got plenty of roll here.
Well, think it's the right direction.
You go on, girl. That's wonderful. Thank you, buddy. We good. We good. I've got this barrier. It doesn't say to have it, but tell them to do it because I'll give them somewhere to put the toothbrush. Water. Sometimes the evaluator will tell them to get it out of the spigot. Sometimes they'll have water provided. Reese's basin, gloves. Okay, I think I'm good. If I'm not, I'll stop and get it. All right. Do what now? Oh, thank you, darling. And if your student forgets something like I just did, help them be comfortable with the notion that it's okay. When they open up this thing right here, they're going to think of it. Lay it down on that barrier right there so they can get credit for clean handling of the toothbrush and just go get it. Thank you for the toothpaste reminder here. All righty, ma'am. You ready to brush those teeth?
Mm-hmm.
All righty. Okay, what does it say about the head of the bed? What are we going to do?
Put it on the side of the bed.
Put it on the side of the bed. All right, Missy, let me help you sit up here. And I got my hands on her. I am assisting her. Where are your shoes, baby?
On the way under the bed.
Mm-hmm. Let's slide those shoes on, Miss Beth. All righty. So she is sitting at a 90-degree angle. So we're cool with that. All right, watch your feet. Okay. And I'm not going to wrestle with that. I've already encountered that thing. Okay. Now, Miss Beth, I'm going to put this around you because you and I might get messy. Okay.
Okay.
So, let's just go ahead and put this on around there. Alrighty. I'm going to take that out in such a way that I don't touch that end. And I'm going to open my toothpaste flap or take the lid off or whatever. I'm going to do anything I can do so that when I put these gloves on, I'm minimizing my spastic attack. Because they will have one. I know you're tired of me asking, but what's going to happen if they don't put gloves on? They'll stop them, say, put your gloves on, and they'll get a ding for it. Okay, now, wet the toothbrush. You can do that a couple of ways. This water's clean, so if you want to dip it in there, that's fine, because that water's clean. We just poured it, right? Or, if you feel better with them pouring it out of the bottle in there, or if you feel better having 2 cups, whatever. Whatever works for y'all. But that toothbrush has got to be wet. Alrighty, we're going to put a little toothpaste on here. Now, in some of the nurse aid textbooks, it says not to touch the toothbrush with the toothpaste. Does it say anything about that in there? So don't let them sweat that, because I've seen too many people.
Didn't that used to be an issue that we had to have a separate tube of toothpaste for every toothbrush or something years ago?
Yeah.
I mean, I understand that. I do, but
yeah, and if it's their toothbrush and their toothpaste and their toothbrush,
right.
But it just breaks my heart when they're struggling so hard not to touch it, and it's not even something I'm watching for. All right, it's been a long time. I think it might have gotten dry. I'm gonna dip it again. All right, sunshine. Can you just make a tea like that, honey? Okay, now we're just gonna brush them teeth. Ooh, sorry, dribble, dribble. Here we go. All right, now let me really open your mouth. Let me start back here. All right, jiggle, jiggle down, jiggle, jiggle down, jiggle, jiggle down. Jiggle, jiggle up, 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 and jiggle, jiggle up, jiggle, jiggle up. Now, I'm not going to take the time to do all of them like that, but that's what they need to do. Miss Beth, stick your tongue out there. You've been wanting to do that all day, haven't you? All righty now. Okie doke. All right, do you want a little water before you try to spit? Please. All right. Now, I wiped her mouth. Now, you want a little bit more water?
I'm good, thank you.
Are you sure?
I want a little more.
For real?
Yeah.
A little more? Swallow, swallow. I mean, not swallow, swallow. Jiggle, jiggle. Shoot. The word I'm looking for is swish. Beth, we're getting to know each other on a whole nother level here. Okay, now. Woo! Alrighty now. So, I'm gonna, she's cool. I know you're worried about her sitting up on the bedside, but she's an okay patient. I'm gonna dump this out. I'm gonna rinse it. I'm gonna dry it too, but not right this second. I mean, I could. I'm gonna close the top of my toothpaste, just sit it over there. And I'm gonna clean this toothbrush. Now remember what I said about toothbrushing. Baptizing is not cleaning. When the toothpaste is gone, and all the sandwich is gone, and her multigrain is gone, then it's clean. Okay. I'm gonna get me some paper towels here. And I'm gonna dry this toothbrush. It doesn't say you have to dry it, but I just think that's kind of a good habit while you're in the drying business. It really shows that it's clean and you're handling it with care and you're not leaving it wet. You don't have to put a paper towel on it either. But I kind of like that notion because I want to get all my kudos for handling that toothbrush in a clean manner. I empty rinse, and now I am drying this basin. I'm going to put the toothbrush in the basin because that's hers. That belongs to Miss Beth. Put it in the designated dirty area. All right, Miss Beth, I think we wiped you, but let's just be sure we did here. Yeah, good. All right. I'm going to put this in the dirty laundry. Finish cleaning up my mess here. Put this in the trash. And let me do this one here. Take my gloves off. And put that in the trash. And wash my hands. And let's say that I realized that maybe I might, that would probably be alright leaving there. But let's just say that I really want to put it back on the table. Alright, here's your call bill, dear. Thank you. And I don't know if I did or not, but I should have pulled that curtain. If I didn't, I would have pulled it, and now I'm going to open it back up and wash my hands. Okay, how'd we do? How'd we do? Alright, what are the things in there you want to watch for? Things that you think might be problematic? Do what?
Never forget the tongue.
The tongue. We've been preaching that so long now, they're fairly good at doing that. But that doesn't mean that your new people will be. Okay, what else? Who handles the emesis basin?
The nurse, the CNA's
The
client.
CNA, the candidate does. Right. If they say, here, spit in that, and then she picks it up herself and puts it up there, they get no credit for that. The candidate has to be the one placing the emesis basin. So that's one you got to be careful for them there. What I was meant to show you a while ago that happens, and it's really begun to scare me quite a bit, is that the kids will be working and they've got the toothbrush in their hand because they're brushing the teeth and they haven't cleaned it yet. They don't want to lay it down because they know that's a no-no. They know you'd kill them for that. So they'll take it and put it in their hand like this and hold that cup and have water in the cup. Now what happens to that eyeball?
Brushing eye.
I have come so close to having an emergency stop for that, it scares me. I mean, who would have thunk it? But that's what happens if they don't know what to do with this. So if you just teach them, get them a barrier down there, anytime you don't know what to do with it, lay it on the barrier. You're okay. Then you can give them the water in safety and not have that to deal with. All right.
They should lay their toothbrush down if they're not using it.
If they're not using it, tell them to lay it on the barrier. Because what happens is they get too much stuff in their hands. Y'all can manage it. Teachers can manage anything. But these young people who haven't experienced life as much, they don't know how to juggle 5 things in their hand like you do, especially after you have a baby. It's a skill that just, the Lord provides us with. Okay, what's your next?